Our topic today: myocardium, palpitations, circulatory failure, athlete's heart. Welcome to International Academy Germanischer Heilkunde by Dr. Hamer, MD. My name is John Holidauer. At GHK Academy, I'm responsible for representing the original seminar program, according to Dr. Hamer, in the English language. We are at the myocardium, that is, the heart muscle, which is the orange group. The large chambers of the heart are striated muscles, orange group, and are controlled by the cerebrum medulla. The large chambers are to be distinguished from the atria, which originated from the smooth-walled intestinal musculature and is controlled by the midbrain. With the atria, we would be in the ventricular fibrillation. However, in this video we will discuss the sensible biological special programs from the heart's right and left large chamber. The blood circulation. The deoxygenated blood gets into the right atrium, into the large right ventricle, and from there it reaches the lungs, where the gas exchange takes place. The oxygenated blood comes back from the lungs into the left atria, the left large ventricle, and back to the periphery of our body. The associated conflict content of the myocardium is an overwhelming conflict, in the sense of why isn't he doing as I want him to do? But the conflict content could also be an overreaching, in the sense that I was cheated. In the conflict active phase, the heart muscle necrotizes. This necrosis is misinterpreted in conventional medicine as the result of a blocked coronary vessels. The muscle, therefore, does not die as a result of a lack of blood supply, as conventional medicine believes, but because of an overwhelming conflict is active. In the healing phase, the heart muscle is replenished with the help of the responsible bacteria and under swelling. In the crisis, the epileptic seizure of the ventricle follows. If the conflict load is low, the epileptic seizure is clonic rhythmic, which is not dangerous. In case of a large conflict load, the tonic seizure, that is, the long-lasting seizure, is dangerous. In the right myocardium, there is a strong palpitation and the blood pressure rises for the duration of the crisis. In the left myocardium, the circulation drops to the basement. If the left myocardium is involved in a major conflict and the seizure continues for a long time, the patient may die within a few minutes. This is also the sudden infant death syndrome. When the crisis is survived, the swelling in the myocardium will decrease. However, at the end of the healing, the heart muscle remains thicker than before, which is also the biological sense, because it is a program of the deluxe group. If one gets into hanging healing with this program, the heart muscle becomes thicker and thicker, and in some circumstances the heart valves do not seal properly. This symptom is also called athlete's heart, but it's nothing to do with sport, it's just an overwhelming conflict in hanging healing. In the case of the myocardium, the handedness is decisive. Now it gets a bit complicated. The heart has rotated during development. So in the right-handed person, the right heart is not assigned to the partner, but to the mother-child. Thus, when the right-handed person resolves an overwhelming conflict with the mother or the child, he has palpitations and briefly increased blood pressure at night. The most frequent crises occur about 4 a.m. If the right-hander solves an overwhelming conflict with his partner, he has circulatory collapse in the crisis. In the cerebral medulla, from where the myocardium is controlled, there's also the brain relay for the diaphragm and the genitive, which has a similar conflict content, namely, I'm running out of breath. The diaphragm is also striated musculature. If this diaphragm reacts along now, this will also make an epileptic seizure, and the patient has an additional respiratory distress. So when a right heart myocardium seizure, you have palpitation up to your throat, and often, in addition, you have shortness of breath. It's scary, but not as dangerous as the left myocardial seizure. If the patient then goes for an examination, this seizure is already over, and in most cases the conventional doctors find no urgent changes on the heart. Similar to the epileptic patient, in which one also hardly finds any change in the skeletal muscles. Often seriously ill patients feel overwhelmed by the suffering and react with the myocardium. Then, when they are on the road to recovery, they often resolve this overwhelming conflict and then spontaneously die of a left heart myocardium attack. Case study. Dr. Hamer once told me the following patient case. A somewhat 50-year-old man hit the lift column while skiing, and he suffered a scare-fright conflict. When he could solve this scare-fright conflict after some time, this brain relay stored edema, and he had an operation for the supposed brain tumor. Due to the severe medical conditions, his marriage broke apart and his wife wanted to divorce him. He suffered a conflict of overwhelming towards his partner. As a right-handed man, his left myocardium was affected. In addition, he suffered a refugee conflict with his kidney collection tubes, because now he was left alone. Because of this water retention, his surgical cavity in the brain filled up again, and he was about to have a second brain surgery. Only now they found their way to Dr. Hamer. When Dr. Hamer decoded this conflict, the wife realized her co-responsibility and declared that now she would not leave her husband after all. Dr. Hamer said, "If that is the case, you do not need brain surgery, but you must go to a cardiac clinic immediately. You will solve your left heart myocardium, and it is wise to be already in the intensive care unit by then." The patient went home, and he went straight to a cardiac clinic, still on the same day. The doctors there listening in amazement to the patient's explanations and finally agreed to keep him for monitoring. A few days later, he had his left heart myocardial seizure and he survived. This case study should illustrate that in Germanische Heilkunde we can predict crisis and act accordingly in advance. Have fun with your studies and goodbye. Until the next video.
Germanische Heilkunde is considered by those who have understood its underlying principles to be the most significant discovery in known human history. While conventional medicine is based on more than 5,000 hypotheses, Germanische Heilkunde can be proven at any time to be the only medicine that is scientifically verifiable. With Germanische Heilkunde, for the first time in recorded human history, there is a scientifically verifiable medicine for each patient case. More than 30 medical universities have already confirmed this in the past. Still, Dr. Hamer's discoveries have been suppressed and denigrated for over 40 years. Take your health into your own hands and learn Germanische Heilkunde while you are still healthy. For this purpose, the GHK International Academy offers you an extensive program of seminar tutorials from the basics through the organ level to the psychoses. This seminar program will change your relationship with your body and your health once and for all. You will find the direct link to the homepage of the GHK International Academy below the video.